Bharat, are we live now?
Yes.
No, ma'am, we are not at live.
We are
Yeah,
live.
ma'am. Yeah, we are on live.
So we are on live, sir. We are on live, sir.
Yeah, yes. So very good evening, doctors. I am Dr. Stalin on behalf of Shield Healthcare, welcoming you all for today's webinar. The topic for today's webinar is
Bharat, are we live now?
vaginal
Yes.
microbiome. We are not at live.
We are live.
Yeah, we are on live.
So we are on live, sir. We are on live, sir.
Yeah, yes. So very good evening, doctors. I am Dr. Okay, I welcome all the audience and I request them to post their queries, if any, in the chat box so that we can go for the Q&A session at the end of this presentation. Now it's time to introduce our invited speaker for the day, Dr. Saradha, JL Saradha ma'am. Madam has done her MBBS and DGO, and Madam is currently working as a gynecologist and obstetrician in Quality Care Polyclinic, Tirunelveli. And Madam has held various posts in various hospitals like Madam was the obstetrician and gynecologist in Sir Evan Stanford Hospital, Chennai, registrar in Sundara Medical Foundation, Anaganagar, Chennai, a family welfare medical officer in Periyar Urban Family Welfare Sector in Veperi, Chennai. And Madam has also worked as a senior resident in ACS Medical College, Valappanchavadi, Chennai. And Madam has received various awards to her service like a Memento for healthcare program of unprivileged children from 2005 from TN Governor, His Excellency Sujit Singh Barnala, and also another recognition of service award from Rotary Governor Dr. Vijay Kumar. So with this short introduction, I welcome you, ma'am. I'm handing the session to you for your presentation, ma'am. Welcome, ma'am.
Yeah. Thank you very much. I thank the Shield Pharmaceuticals for inviting me to this CME program. They are doing a very great job. And almost every now and then we have a CME which is aired. And I'm very thankful to take part in this program today. So today's topic is decoding vaginal microbiome. So to recapitulate the basics, the biology of the vagina in adult women, the white coagulated material consists of the squamous cells, the dodolens bacilli and coagulated secretion. So the dodolens bacilli are the gram-positive organisms which converts the glycogen into lactic acid. So these are the dodolens bacilli are the commensals which are in the vagina, and they convert the glycogen into lactic acid, which is responsible for the acidic pH of the vagina. So as you all know, the vaginal mucosa is stratified squamous epithelium, and the superficial cornified cells of the vaginal mucosa, they produce glycogen under the estrogen stimulation. So what happens is this dodolens bacilli converts or breaks down this glycogen into lactic acid, and which is responsible for the acidic pH of the vagina, which is about 4. Okay. So next is, now there are a number of flora of the female genital tract. As I told you, the dodolens bacilli or the lactobacilli responsible for the production of the hydrogen peroxidase, which is toxic to the other pathogenic organisms. Then there are facultative organisms like the diphtheroid, coagulase negative staphylococci, streptococci, so many organisms which can be isolated, but they are in reduced number. Coming to what is leucorrhea. So as we all know, the definition of leucorrhea is the normal, the physiological vaginal secretion, but which is increased in amount. So this is a very physiological conditions which can be pathological in certain specific vaginal infections like the gonococcal, the trichomoniasis, the candidiasis, the chlamydial, and the bacterial vaginosis. So except bacterial vaginosis, all other infections are mostly sexually transmitted. So vaginosis is nothing but the shift in the flora. Vaginosis is the shift in the flora from the normal lactobacilli, the commensals, to the pathogenic bacteria. Now vaginitis, it signifies the inflammation of the vagina. So what are the risk factors which leads to these type of vaginal infections? Poor personal hygiene. Today is the menstrual hygiene day. So poor menstrual hygiene, the obesity, using too much soap, uncontrolled diabetes, wearing tight clothes which are too tight, and not having frequent keeping the perineum hygienic. Use of feminine deodorants and douches are associated with increased in infections, and other unhygienic or not recommended sanitary products. Then excessive use of antibiotics and hormonal contraceptive. We know that excessive use of antibiotics, it reduces the commensals in the vagina, and that predisposes to vaginal infection. Stress, then change in the sexual partners, the sexual promiscuity, the unprotected sex with somebody who's got STI. So all these things predispose, and of course any procedure in the reproductive tract, that also predisposes the woman to these type of infections. Now coming to candidiasis. So candidal vaginitis, as I told you, all the risk factors, mostly the responsible organism is the Candida albicans. There can be other organisms which are responsible also. Mostly the uncomplicated candidiasis is caused by the Candida albicans. And I told you the various risk factors, the unhygienic maintenance of the perineum, and so many other risk factors which I told you, and also the immunocompromised individual, like long-term use of steroids, then the HIV infections. So all these things can predispose the woman to candidiasis. So diagnosis is by the clinical. We all know that the white, the thick, the curdy white discharge is pathognomonic of vaginal candidiasis. So there is erythema, vulvar erythema, and the symptoms are pruritus, dysuria, and a patient will come to us with complaints of discharge, which is curdy white discharge. So this is a picture of the typical candidiasis. Okay, she will come with symptoms of pruritus, vaginal soreness, dyspareunia, dysuria, all these things. So, okay. Can I move the screen, please? Hello?
Just click on
Not moving, madam.
Yeah, it's not moving. I'm not able to see the lower portion. The lower portion I'm not able to see. Can I just, somebody move the screen, please?
Ma'am, the control is with yours.
Not able, madam. You can change the next slide. Madam.
Not able to do it. That's what okay, it's okay. So now we go to the complicated and the uncomplicated vaginal candidiasis. So I told you, most of the time the women comes with history of discharge, and when you see these white, the curdy white discharge, so we make a diagnosis of, we think it can be the vaginal candidiasis, and we start investigating for that. So complicated vulvovaginal candidiasis. So she comes with extensive vulvar erythema, excoriation, and so when you see the vulva, there is excoriation and fissure formation. It associated with a lower clinical response rate. So and it can be associated with immunocompromised individuals. So that is complicated vulvovaginal candidiasis, wherein most of the time the organism is something other than the Candida albicans. So the patients treated with short courses of topical or oral therapy, either so there is lower response rate when the patient is treated with short course. So either we have to treat it with 7 to 14 days of topical azole or oral fluconazole, and we have to repeat the second dose after 72 hours. In a case of severe the vulvovaginal candidiasis. So compromised hosts, women with underlying debilitating medical conditions, that is those with uncontrolled diabetes or those receiving corticosteroid treatment, they do not respond well to short-term therapies. Efforts to correct modifiable conditions should be made and more prolonged. So we have to give them more prolonged therapy for 7 to 14 days, and conventional antimycotic treatment is necessary. So vulvovaginal candidiasis very frequently occurs during pregnancy. So pregnancy only topical azole therapies are recommended, and it has to be applied for 7 days. So the investigations, we can do a KOH treated wet mount, and the culture media used are the Sabrod agar and the Nickerson's medium. So we can do various preventive measures, as I already told you, prevent the risk factors which lead to candidiasis, and we recommend antifungal creams or pessaries. So the oral antifungal agents are what we popularly use, the oral fluconazole. We can give as 150 milligram single dose, or the itraconazole tablets. Now the clotrimazole comes as a cream or the vaginal pessaries. So it is 2% cream or 5 grams cream which is applied intravaginally for 3 days, 3 consecutive days. Now, for recurrent vulvovaginal candidiasis, we have to give a long-term therapy, which is fluconazole 150 milligram orally every 72 hours for 3 doses, followed by 150 milligram weekly for as long as even 6 months we might have to give. Or alternatively, we can use either miconazole or itraconazole tablets. Now, coming to bacterial vaginosis. So, as I told you, vaginosis is the shift in the flora, the vaginal flora, not exactly an inflammation, but it is a shift in the vaginal flora. So this is very important. This condition is being recognized very much nowadays, because this can, especially in pregnancy, can predispose to the occurrence of preterm labor, chorioamnionitis, premature rupture of membranes, etc. And it can also predispose to increase in sexually transmitted disease. So bacterial vaginosis as such is not an STD, but it can predispose a woman to a sexually transmitted disease. So bacterial vaginosis is the name of the condition in where the normal balance of the vagina is disrupted and replaced by an overgrowth of certain bacteria. It is sometimes accompanied by discharge, odor, pain, itching, or burning. So most of these patients, either with as I told you, the candidiasis, bacterial vaginosis, or the trichomoniasis, they come with discharge. So when we look at the discharge, we have to first clinically make a diagnosis just by looking at the discharge. What is the organism that is responsible for that? So when we look at the discharge, when we look at the curdy white discharge, so it can be pathognomonic of the candidiasis, and especially when we try to remove that curdy white discharge, it can leave bleeding spots. So that is pathognomonic. Now coming to bacterial vaginosis, she can come with a profuse discharge. It will be a homogeneous discharge. Okay, it can be a white homogeneous profuse discharge she can come with, and sometimes it can be accompanied by a fishy odor. So, there can be a number of organisms which are responsible for the bacterial vaginosis. So, the normal commensal itself can lead to this kind of condition, and there is a reduced lactobacilli. The lactobacilli are the normal, the flora, the lactobacilli or the Dodolins bacilli, they inhabit the vagina, especially the upper 2/3 of the vagina. Exclusively are colonized by the Dodolins bacilli. So when there is bacterial vaginosis, there is overgrowth of other pathogenic bacteria. So growth of aerobic and anaerobic bacteria, like your Gardnerella vaginalis, or the Mycoplasma hominis. So all the Mobilincus bacteria. So all these things, they grow and they replace the normal flora of the vagina. So when we look at the discharge, So it can be white milky, I told you. It will be a homogeneous discharge and the pH is more than 4.5 and there is a fishy odor. So when you add potassium hydroxide, that would be a typical fishy odor. And the presence of clue cells. This is pathognomonic of your bacterial vaginosis. The clue cells are nothing but the epithelial cells with the adherent bacteria. And your diagnosis is based on wet smear and culture and the reduced lactobacilli. So treatment is a 7 days course of metronidazole 500 milligram BD, which we usually give, or it can be used as a gel. Then the clindamycin. So nowadays we use we combine the azoles with the clindamycin. We give it as pessary, or we can even use it as an oral clindamycin or clindamycin cream. Oral clindamycin is 300 milligram BD for about 5 to 7 days. Clindamycin cream is 5 grams for 7 days, and we use the lactic acid wash. So Nugent score. So this is the age-old scoring system which we used for the diagnosis of the bacterial vaginosis. It's a gram stain, and we identify the bacteria. So a score of 7 to 10 is consistent with bacterial vaginosis, but this score is nowadays rarely used. Now coming to the next this thing which is called as the Amsel's criteria. So include 4 criteria, which is the pH, the clue cells, the white discharge, the pattern of the discharge, and the odor of the amines with the addition of the 10% potassium hydroxide. So when there is 3 out of 4 criteria, we diagnose this as the bacterial vaginosis. So coming to the probiotics, so the probiotics is the recommended therapy, it is a lot of research has been done in the probiotics, and we do recommend the probiotics for the treatment of this condition. So what they do is they adhere the probiotics. They are nothing but live microorganisms which adhere to the epithelial cells, and they prevent the pathogens from producing the disease. And this is nothing but the lactobacilli, the various lactobacilli. So we give these lactobacilli as probiotics, and they colonize the vagina, and they inhibit the growth of the pathogens by producing the hydrogen peroxide, and they also produce the lactic acid, which is deterrent to the pathogenic bacteria. Now coming to Trichomonas vaginalis caused by the protozoan Trichomonas vaginalis. Many infected women have symptoms characteristic of diffuse malodorous yellow-green vaginal discharge with vulvar irritation. So profuse frothy greenish yellow discharge. So that is pathognomonic of Trichomonas vaginalis. So 50% of the women infected with trichomoniasis, they do not have symptoms. So the severity of discomfort varies greatly from women to women. So vaginal discharge, profuse, frothy, greenish, foul-smelling, itching, irritation, pain. So all these things, painful dysuria. So these are the these are a pathognomonic of the Trichomonas vaginalis. Now also when you examine, so you can find out the discharge and also the strawberry cervix, which is also pathognomonic of this Trichomonas vaginalis. Now the treatment consists of the metronidazole 500 milligram twice daily for 7 days, and we also treat the partner. With metronidazole, we can give it either as a 2 grams stat dose, or we can use the tinidazole. So these are the various treatments. Now coming to the probiotics, which is the topic of today. So these are as I told you, they contain the lactobacillus and used over long periods and as an alternative to antibiotics. So this probiotics nowadays it is coming up in a big way. And probiotics, they don't have any adverse effects, and it is also it has been found to be safe in pregnancy, and the possibility of harnessing specific bacterial strains in order to prime the vaginal microbiota is the mainstay of the treatment. Now, as I told you, live microorganisms, which when administered in adequate amounts, confer the health benefit on the host. So main types are, so what are the probiotics? So the lactobacillus, then the bifidobacteria, etc. So day to day, we see the yogurt and the dietary supplements which contain these probiotics. Now, so these are the various mechanisms by which the prebiotics are the compounds that induce the growth of these beneficial bacteria, and they stimulate the growth and the reproduction of useful microflora. They maintain the optimal pH in the intestine. They stimulate the local immunity. So these are the various mechanisms by which the prebiotics act. So prebiotics, they are they are chemicals which increase the growth of the good bacteria, like the fructooligosaccharides, etc. So, so this is the probiotic and the mechanisms by which they confer the intestinal immunity. So nowadays the gut immunity is the pathognomonic of the start of the various diseases. So when the gut is colonized by the good bacteria, they confer the immunity. So there are various mechanisms by which the lactobacillus and the bifidobacterium, they regulate the cytokine expression, the modulation of the phagocytes, the modulation of the IDC maturation, and the modulation of the T cell differentiation. So by all this, they influence the gut immunity. So I told you about the probiotics and how it increases the immunity. So the major concerns are bacteremia, adverse immunological effects, and antibiotic resistance transfer. So it mostly the bacteremia is diagnosed with immunosuppression, prolonged hospitalization, prior surgical intervention. So in a healthy individual, they have not been found to have any adverse effects. The probiotics have not, in a healthy individuals, they have found to have very or minimal adverse effects. So use of probiotics are generally safe, but these patients should be monitored when using probiotics. That is, as I told you, the immunocompromised, very premature infants, patients suffering from short bowel syndrome, those with any prosthetics like central venous catheters and etc., elderly and patients with cardiac valve disease. Why probiotics for infection treatment? So these are the reasons for that. New problems created by antibiotics is disrupting of the protective flora, antibiotic resistance due to abuse and overuse of antibiotics. We are running out of antibiotics, and interest in the usage of ecological methods. So these are the rationale for using the probiotics. And also the when these pathogenic bacteria, they form the biofilm. So they adhere together and they form the biofilm, which are the antibiotic penetration is prevented by the formation of this biofilm. So these lactobacilli, they are found to decrease the formation of this biofilm, or they are found to they aid the action of the antibiotics on the biofilm. So vaginal probiotics, clear hypothesis about the role of lactobacilli, established protective role. So application can be toxic. The application can be topical, reaching the high inoculation levels. No organoleptic consideration, easy to perform clinical trials. It is readily available. So I told you the various rationale for using the lactobacilli. Develop a non-chemotherapeutic probiotic therapy using lactobacilli to maintain healthy lactobacilli-dominated vaginal flora, sexually transmitted disease. They prevent preterm labor, good quality of life for women inserted directly into the vagina. So nowadays we have the oral preparations. Still the vaginal preparations are yet to come. We have the oral probiotic preparations to treat the vaginitis. So the oral preparation, they colonize from the gut to the vagina, used in women prone to urogenital infections during, and also for healthy women to maintain the vaginal flora. So in healthy women as a prophylaxis to maintain the normal flora, and lactobacilli probiotics can be used over a long period without adverse effects, unlike antibiotics. So antibiotics, so there's a lot of side effects using antibiotics. So the rationale for using the probiotics is to suppress the pathogenic bacteria and so thereby preventing the disease. So probiotics versus antibiotics, they damage the commensal microflora, increases the occurrence of resistant bacteria. They can have adverse effects. They can be used in conjunction with antibiotics to restore the commensal microflora. So, and the lactobacilli, what we use the Indian specific genome. So they have found they have done a lot of studies and they found specific lactobacillus colonies which are specific to the Indian population, and they have found to be more useful when we give it for these specific vaginal conditions. So now these are the various studies: biological control of vaginosis to improve the reproductive health. So exogenous strains of lactobacilli have been suggested as means of re-establishing a normal healthy vaginal flora. Carefully selected probiotic strains can eliminate bacterial vaginosis and also exert an antiviral effect. So even in a viral infection, the probiotics have been shown to they have an antiviral effect. Even nowadays there are studies which shows that even the human papilloma virus, the oncogenesis of the human papilloma virus also it is decreased. So even in cancer, the probiotics have been shown to be useful. That is the recent study which I read. Then coming to yeah. So these are the abnormal vaginal microbiota may be associated with poor reproductive. So even in reproductive, the assisted reproductive techniques, the probiotics have been found to be useful. So why strains of native origin? So they won't have the same. Products with strains of Western origin may not have the same benefit. It is now widely accepted that native strains will have better efficacy on the local population, and products should have the advantage that all the strains are of native origin with clinical study and safety validated in Indian populations in establishing efficacy. So these are the right lactobacilli. So these are the colonies which are normally found, various colonies. So treating of bacterial vaginosis increases the pregnancy rate. So use of probiotic strains for the treatment of bacterial vaginosis. These are the various studies where they use the vaginal capsules, and the results are published. So these are the various studies which are being used to find out the usage of probiotics in bacterial vaginosis. And so in this study, they found 21% cure rate compared to 0% the control group, then 88% cure rate. So various results have been published, and all of them have been found to be beneficial. Treatment of bacterial vaginosis with probiotics in combination with antibiotic therapy. So they have so it has found to aid the efficacy of the antibiotics. So usage of probiotics in conjunction with antibiotics have been found to be beneficial. So these are all the various studies which are there. So to summarize, the vagina has got its own defense mechanisms. So the lactobacilli, they colonize the vagina, and there are different microorganisms which can be isolated from the vagina. Most often the bacterial vaginosis, the pathogenesis is the shift in the flora from the good bacteria to the bad bacteria. So and when we give these antibiotics along with the probiotics, it has been found to be beneficial. And nowadays the lactobacilli or the probiotics have been found to be beneficial in various conditions. So this is the summary of the talk today. If there is any doubt, you can ask me. Thank you.
Thank you, ma'am. Thank you very much, ma'am, for a wonderful presentation, ma'am. Ma'am, let me wait for 1 or 2 minutes for the participants to post their queries. If there is any queries, then I'll read it for you, ma'am.
Yeah.
Audience, if you have any queries, you can just post in the chat box so that I can raise the question to madam. Ma'am, whether these hormonal imbalances in women can cause this bacterial vaginosis, ma'am?
Hormonal imbalance.
Yes, ma'am.
Yeah, see, bacterial vaginosis has been found in certain conditions where we use the oral contraceptives, then in pregnancy, then immediately in the peripherum. So what happens is there is the vaginal pH is altered. It becomes an alkaline pH.
Yeah.
The vaginal pH becomes altered. So in those conditions, there is overgrowth of the bad bacteria. There is shift in the vaginal flora.
Okay.
So yeah, so these are the conditions where you find the bacterial vaginosis.
Ma'am, whether this using these oral contraceptives can be a risk of this vaginal infection, ma'am? Any role in that way?
Yeah, actually the progesterone, the estrogen and progesterone, but the progesterone is supposed to make the cervical mucus thick and prevent the ascent of the bacteria. But as such, the oral contraceptives, they have found to in various studies they have found to increase the bacterial vaginosis, which can in turn lead to the increase in the predisposition to the sexually transmitted disease.
Okay. Okay. Ma'am, whether these probiotics can be beneficial for the PCOS woman, ma'am?
Sorry, I didn't. Can you be a little louder,
whether
please?
probiotics can be beneficial for PCOS?
PCOD, yes. PCOD, yeah, PCOD actually, that's what I'm saying. No, nowadays the probiotics have, become the mainstay of the treatment actually in so many conditions. So PCOD is also an inflammatory condition wherein there is gut dysbiosis and so many other. So nowadays they are giving the probiotics along with the anti-inflammatory agents like the lactoferrin to decrease the gut dysbiosis.
Okay, ma'am. Yes, ma'am.
Yeah.
Yes, ma'am, how long they have to give these probiotics for complete recovery, ma'am?
That depends. Usually we recommend about 2 weeks, but along with antibiotics, we can give it up to a month.
Okay, okay, ma'am.
7 to 14 days is the therapy.
Ideal.
Yeah.
Okay, yes, ma'am. Participants, if there is no queries, we can end the webinar for now. Okay. Ma'am, there is no queries from the participants, ma'am. So if you allow us, then we can end the webinar for today, ma'am. If there is any queries, then we will be sending you to your mail address, ma'am. You can address on those queries, ma'am.
Okay. Okay. Yeah.
Thank you, ma'am. Thank you. Ma'am, can we end the webinar today, ma'am?
Yeah, thank you.
Yeah, ma'am. Thank you, ma'am. Thank you very much for spending your valuable time with us and for being with us today, ma'am. It was a wonderful session once again, ma'am. We are looking for many more webinars with you for in good topics, ma'am. Please do support them, and I would also like to thank our delegates for their active participation. Thank our team, Srinivas and Sivakumar sir, for arranging this webinar. Thank you, one and all.
Okay, thank you.
Thank you, ma'am. Thank you very much.
Thank you.
Thank you.